Good afternoon, everyone. It's a great pleasure to welcome all of you to this webinar, Improving Language Access in Federal Programs, What is the State of Play? My name is Margie McHugh. I'm the director of the Migration Policy Institute's National Center on Immigrant Integration Policy. And we're just really excited to have the guests that we do for this webinar and to have so many folks around the country joining us to hear what we hope will be a really interesting conversation. Before we get going, I just wanted to make a note. Please email events@migrationpolicy.org if you have any difficulties accessing the webinar. And we would appreciate it if you ask your questions throughout the webinar using the Q&A function that you'll find within the system. You can also write to that same address, events@migrationpolicy.org, if you have questions. It's a big help to get the questions in advance, and we know already we have a lot, so trying to figure out how to pull them all together and ask as many as possible of our guests would be really helpful. So just to welcome the speakers who are here with us today, I'll give a bit more of an introduction for each of them a little further on, but just for now, we're joined by Amber Green, Special Assistant to the President for Racial and Economic Justice at the White House Domestic Policy Council. Also, Melanie Fontes Rayner, Director of the Office for Civil Rights at the U.S. Department of Health and Human Services, and also Ben Devanzo, Senior Policy Strategist at the National Immigration Law Center. So just in terms of the flow of show today, I'll just say, first of all, let me just say more about our work here at the center. I know a lot of you who have joined us are familiar with our work, but one of the key things I just wanted to point out is that within the focus that we've had for many years on early childhood education and care, education and training systems, including elementary, secondary, and post-secondary education, adult career, technical ed, and workforce development, language access cuts across all of them. And so since our founding within MPI back in 2007, language access has been a key focus for us. Also seeing it as I guess any of you who are involved in work that is at sort of cuts across issue areas, you understand very well that language access policies both have that sort of horizontal aspect to them when you're in agencies that have a lot of different nodes, and then also definitely a vertical access about how do you go from the top to make it happen at the front at the frontline point of service. So you'll hear more about that as we move through this. I think that set of challenges will be evident. Also, of course, we have a focus on refugees and humanitarian populations, and then very particular for today, part of the reason our center was founded was to try and promote conversations at the federal level to improve the governance of integration policies. And so we're delighted that we're having this conversation in the context of the White House Task Force on New Americans operating and being about to report on some of its efforts next week. So it's an exciting time to be having this conversation. So just quickly, a few points of context for the conversation that we'll be having. Next slide. Thank you to our events folks for helping out with this. Very brief overview of language access. I feel looking at the various folks who have joined us for this conversation online, many of you are people who have been working on these issues for a good number of years. So we'll just very briefly talk about provide a very quick overview, and then recent developments that are kind of really the trigger for today's conversation, followed by the panel discussion, and then also Q&A throughout, as we said before. So just in terms of the brief overview, I think all of you know that this question of language access for people who aren't sort of either inside delivering services within government agencies or not inside immigrant and refugee or Native American communities. This idea of language access, it's not the most common phrase to be using with the general public, but of course it for us refers to the ability of limited English proficient individuals to access services and information from government programs, to have language not be a barrier to being able to access those programs. It's a significant issue nationwide. There are over 25 million LEP individuals in the US and speakers of hundreds of languages other than English across all 50 states. And then the requirements for language access are embedded in our federal civil rights laws and an executive order that codified them during the Clinton administration, and then extensive policies and plans and the like that are associated with those sort of places where they are hooked in to our federal laws. So moving forward, just in terms of the context today, we thought we should just be honest up front. It's no news to all of you that there are lots and lots of really significant actions that have been taken, both across all levels of government and many different agencies, trying to ensure language access. And at the same time, many years into these things having been having really been planted firmly in the federal space, it's still an elusive goal to make sure that that we really do have language access across federally funded programs. The pandemic seems to have really raised the issue up in the public sphere. Lots of state and local agencies that I think had not really been aware, or maybe had thought that some of the language access issues had been taken care of, instead saw that we had major breakdowns, including in schools, for example, and in healthcare delivery systems, where I think those might have been the places that folks would have guessed were really doing better with it compared to other parts of government. But the exciting thing for us and for many folks who have been working on these issues for a while is that at the federal level, the Biden administration has engaged in a good number of efforts to foster greater language access in federal programs, and those weren't sort of directly or individually initiated. A lot of what we'll talk about today is some of the executive orders that have promoted cross-agency initiatives where language access is emerging, and where agencies are really taking on the issue in a very pointed way. So with that, I'd like to just get back to introducing the panel a little more formally. And I'm just introducing them in the order in which we'll be asking questions. So first, we're delighted to have Amber Green, who's a Special Assistant to the President for Racial and Economic Justice on the Domestic Policy Council. She has an extensive history working on social justice issues, including advancing them through policies and practices of government agencies and in the private sector. For example, while serving as Director of Policy at the New York City Office of the Public Advocate, Ms. Green led efforts to close the gender wage gap, equip police officers with body cameras, and improve voting for people with disabilities. And she now leads implementation of the President's executive orders on racial equity and support for underserved communities. So you can readily imagine why we're very happy to have her with us. And then next, it's also a great pleasure to welcome Director Melanie Fontes-Rainer, who is the Director of the Office of Civil Rights at the U.S. Department of Health and Human Services. There, she leads the department's enforcement of federal civil rights and privacy laws and directs related policy and strategic initiatives. Previously, Director Fontes-Rainer served as counselor to Health and Human Services Secretary Javier Becerra, providing strategy guidance to the Secretary on issues pertaining to civil rights, patient privacy, reproductive health, and the Affordable Care Act, competition in healthcare, equity, and the private insurance market. Before joining the Biden-Harris administration, she held senior positions in the California Department of Justice and at the Senate Health Committee. And I've hardly done justice to, and will not do justice to, the incredible careers and contributions of all three of the speakers here today. So I'd encourage you to find them on the web. It'll make you want to ask them twice as many questions probably as you're going to be able to ask today. But finally, we're also so pleased to be joined by Ben Devanzo, who's a senior health policy analyst at the National Immigration Law Center, where he works on access to healthcare and healthy lives for low-income immigrant communities. His work involves advancing policies that enhance the health of immigrant families and seeking to block those that bring harm, with a particular focus on federal legislation and executive action. He previously held positions with a number of leading national health policy organizations, including the Asian and Pacific Islander American Health Forum and Families USA. All right, so with those introductions, we are going to dive pretty quickly into the questions that we have for the panelists. We've asked all of them to move kind of quickly through their answers because we have quite a few that we're trying to get to. So Amber, one of the things, as I was saying in the setup for this, we have three really significant executive orders that President Biden set forth in the early days of his administration. And the first that you're leading is related to racial equity in federal programs. There's also one on immigrant integration that followed within a few weeks of that first one, on improving racial equity in federal programming. And then also, of course, supporting AAPI and Native Hawaiian communities. And the implementation of that executive order has had a lot of agency participation as well. So we figure you have a pretty bird's eye view of the ways in which language access is sort of involved in all of those, and also you have all these plans that are coming to from federal agencies. So we just love to hear whatever you'd like to say that's sort of an overview of how language access is involved in what you're seeing across federal programs, particularly, of course, related to these executive orders.
Absolutely. Thank you so much, Margie, and I appreciate MPI for hosting this event, Jake, and very pleased to be joined alongside Melanie and Ben. Sorry, my throat. I just wanted to just first, again, thank you all for having this conversation, because as you mentioned, it's things that agencies, have been called to do, through these executive orders, but there's ways that we can all learn from one another, and hopefully this conversation will lead to more of that. As Margie, as you mentioned, on day one of his administration, President Biden signed an executive order to make equity and racial justice a business of the entire federal government. So this had never been done before. Every agency had to identify the often visible and sometimes invisible barriers that have excluded so many Americans, and then identify some strategies to address those barriers, from how we allocate resources to equity and how agencies implement their programs, civil rights protections, and that also includes improving language access. He's noted there are about 68 million people who speak a language other than English at home. That's nearly triple what it was since 1980. As you also mentioned, there are about 25 million people in the U.S. who also had limited English proficiency. That counts for about 9% of the U.S. population. When we think about that, it's critically important, especially in times of crisis and matters of public health, to ensure that our government can provide the timely services and information to communities that are most vulnerable, and that includes LEP communities. And as a result of the executive orders, as you mentioned, last year, more than 90 agencies released equity action plans. This year, we're gearing up for that process again. And in those plans, they identified specific strategies that they should prioritize, from issuing new anti-discrimination regulations, to making it easier to apply for federal grants, to reorienting civil rights offices to be more proactive in pursuing enforcement actions. When you think about it, it's really a whole of government approach that informs all of our policymaking across each of our agencies. And we're keeping our foot on the gas. In February, the president signed his second executive order on racial equity and support for underserved communities, which deepens the administration's commitment to that issue. It directs agencies to take a number of steps to further advance equity, from publishing annual equity plans, engaging regularly with underserved communities, establishing senior leadership teams. And one thing that we made sure to put in, and this is again based on feedback and just information that we've received, is that we really needed to think about how do we deepen our commitment to civil rights. So you'll notice in the executive order, we specifically direct agencies to improve language access services to ensure that all communities can engage with agencies, respective civil rights offices, including by implementing Executive Order 13166, which is improving access to services for persons with limited English proficiency. And then I just wanted to, if I have a moment, to share a couple of agency highlights, if I may. So a couple of things that I think are particularly notable for this group, that in November 2022, the Attorney General issued a memo requesting that all federal agencies review their language access practices and policies to strengthen the federal government's engagement with LEP communities. And it outlines a course of actions for federal agencies to improve and modernize their language access responsibilities under EO 13166. DOJ Civil Rights Guidance also released a new guide to support agency efforts to collect language data, taken together with the new task force on new Americans that domestic policy runs. This issue will be included in the task force action plan to be released later this year, and the inclusion of this work in the agency equity plans, which I'm reviewing now. And we're seeing more and more agencies developing new policies to improve language access in their materials, in their outreach and their engagement. For example, HHS increased language access to vote.gov, which is now available in 16 languages. USDA's farm production and conservation teams translated more than 730 products spanning 30 separate languages, created 200 new Spanish language web pages on farmers.gov. Like, the list goes on and on, but there is more that we can do. And so these are just some of the examples of what we are taking in terms of creating that action based on what's driving the executive orders and ensuring that agencies have the tools and the resources to meet the needs of so many people from the LEP community. Thank you.
Great, thanks, Amber. And Melanie, that's sort of ending up with some of these agency examples is a great pivot over to you. There's this interesting thing going on, of course, with the various executive orders, but then HHS has always had a pretty big portfolio, related to language access issues, and particularly your office, the Office of Civil Rights. So we were delighted that to see that HHS included language access as the first named area of work in its equity action plan for EO 13985. And also that you've restarted the work of an agency-wide language access steering committee. But just given this fantastic reach and size of so many HHS programs and funding streams, I should probably give you a half hour to answer this question, but could you tell us more about the key issues and strategies that you and I guess the agency a bit more generally are focusing on to address language access?
Yeah, absolutely. And in health, it's important across every single part of the federal government, but if you don't know what a doctor is saying to you, you don't know what's happening to you, what kind of medications you're taking. If someone's using a machine readable translation, if somebody's using a Google Translate, there are real implications for what can happen to you and your health. And at the U.S. Department of Health and Human Services, as noted, our breadth and scope of programs is a lot in the healthcare space. It's also in the human services space. And so we, as part of our equity response to the president's call to action on the executive order, we are working on our language access work. It was dormant for a while under the previous administration. So we've relaunched a language access steering committee here. OCR heads that. Every single part of HHS, whether it's CMS, the CDC, FDA, NIH, you name it, is a part of that. Through that process, we are working with every single operating division in HHS to come up with a language access plan, update their existing plans, and come up with new plans. We've brought in a language access coordinator at the department to help serve in a cross-cutting fashion across HHS. We're working with senior leadership to make sure we're implementing the language access component and giving technical assistance in that capacity. My office specifically is both a policy and law enforcement and on the civil rights end for language access. And in that space, I think folks are familiar that last year we issued a notice of proposed rulemaking or a proposed rule on Section 1557 of the Affordable Care Act. That is what I like to call the kitchen sink of civil rights at HHS. It's non-discrimination in health programs and activities. And specifically, we have revamped the language access provisions in that rule. That rule importantly also gets to insurance, which is a really important topic. And we also do a lot of enforcement work in this space. And so I know we have a lot of work and we can talk more about that. I think you have another question on enforcement, but the department's Office of Minority Health, which were created by the Affordable Care Act, some of them are working to put out grants on language access services. HRSA just put out language access service grants. And my office is also really trying to talk about this in a way that it's just communication as an entry point. So it is both for persons that have limited English proficiency, but it's also for persons with disabilities that might not have access to effective communication. And we know, right, in Medicaid and Medicare and a lot of these programs and services, there's a pretty big swath of the population that might be both have a disability and be limited English proficient. And so it's something we're working on in the policy space. It's something we're working on in the law enforcement space. And it's something that every single part of HHS is committed to working on. I'm sure if you heard Secretary Becerra talk in the last couple of years, you've heard him say, right, as a child, he had to interpret very complicated medical documents for his parents, very complicated insurance documents. It is 2023. And this is still not a priority for the healthcare industry, and we're still not seeing it being done in the right way. And so it's really important that we across our department have a commitment to pushing this forward and advancing this for people.
Great, thank you. A lot tied up in everything you just said, and terrific to hear. So Ben, NILC has been working on these issues for a long time, as have you. And you've been particularly closely tracking things that are going on in this administration because of some of the opportunities. Do you want to just say a little bit about what you think the most important issues are that need to be addressed in terms of advancing language access in federal programs? Like, what's your look with with the time remaining for for this administration and beyond, I should say.
Yeah, thank you. And thanks for having me. From the perspective of an advocate and talking with folks who, I've done this for a paltry amount of time compared to those who have been doing this work for decades. This administration really has been one of the first to make language access a clear priority in a variety of ways. And that really presents an important opportunity, between the work of the White House Initiative on AAPIs, the Task Force on New Americans, the work that Amber is leading under the Racial Equity Executive Orders, the updates to the language access plans required by DOJ, and then the agency-specific work like that, like the likes of what HHS Office for Civil Rights is doing. There is just a lot going on in language access, which means that there are a lot of opportunities. And especially we are at a real pivoting point where there's been a lot of discussion and a lot of plans and a lot of proposals and strategies. And we're at a real point where, particularly with the time we have remaining, I think we really want to see real permanent changes that can outlast us, outlast not just this administration, but really our lives, towards making language access not something that you sort of have to push and plead for and keep reminding folks over and over and over. It's been 60 years since the Civil Rights Act of 1964, at least it will be next year. And despite decades of it being against the law to not provide meaningful access to people with limited English proficiency, we just have such a complacency at every level of recipients of federal funding, and frankly, within the federal government too, around language access. And so we have real opportunities in about three areas. I like to kind of categorize them. One is the quantity and availability of language access. Can you get an interpreter? Can you get materials translated? Is there funding for that? The second one is quality. If you have an interpreter, are they respecting interpreter ethics? Or if you get translated materials, are they culturally appropriate or written at the right language level or translated appropriately? And third is the realization of language access civil rights. Do federally funded entities, and frankly, also people working for the federal government, know their responsibilities in terms of providing language access? And do people with LEP know their language access rights? In fact, I'll highlight that Representative Young Kim, a Californian Republican, and Representative Grace Meng, a New York Democrat, together just introduced HR 5762, the Healthcare Communications Access and Resources for Everyone Act, should establish a universal symbol that would help inform people with limited English proficiency about where and when they could access language access materials. So really that third area is how can we actually better realize and make everyone understand that it is a civil right to have language access despite the many barriers. And so we really have opportunities to address all of these areas.
Great. Thanks, Ben. A lot to think about there. Good opportunities, as you're saying. So Amber, I wanted to go back to you and just have you talk a little bit, if you would, about the particular kind of benefit of being at the Domestic Policy Council level and its ability to be advancing initiatives that go across federal agencies and programs. And we have been very excited from the very beginning with EO 13985, along with the Task Force on New Americans and the also the AAPI focused executive order, just thinking about how almost like layering those initiatives and the work that agencies are doing around them on top of one another, that there might be some unique opportunities there in terms of processes or plans, that could come out and have that cross-cutting impact. So could you just say a little bit about, do you see opportunities for expanded cross-agency coordination, and how could that be kind of further leveraged to advance language access across federal programs, knowing that everybody's still going to do their work in their agency silo, but just what are some of the opportunities you might see from a cross-agency coordination perspective?
Mm-hmm. Thank you. So I think the one key area of growth that I think, with our interagency coordination, with the various, with White House initiative on AA and NHPI communities, like that provides us with a great visibility in terms of what additional needs and where we're not serving communities. So those are areas where we have an opportunity to really think about how do we learn from one another. There are some agencies that are way ahead in this work, some that are getting there. So in that space, it allows, an opportunity for us to learn and work with one another. But one area that I think is particularly helpful in terms of a basis to understand like where there is need is the understanding of data disaggregation, and especially for AA and NHPI communities. So as you all are probably tracking, OMB is currently undertaking an independent process to revise race and ethnicity standards. And those haven't been updated since 1997. So this process will ensure that federal agencies accurately collect and use information on race and ethnicity of our diverse America. This action is pretty vital to ensure our programs and policies are effective across the federal government to ensure that we provide appropriate resources to communities that need it most, and in ways especially that are most accessible to them. So I think that'll be something that'll be particularly helpful as we think through how do we ensure that we have sort of a basis of where there is need and where there are varying languages, based on geography and based on community. So that's an area of growth that I think is particularly helpful, and is also community informed. Those revisions should be complete by the end of September 2024, or by summer 2024. And then in terms of AA and NHPI communities, we've made sure that promoting greater language access was really critically important, especially in the administration's national strategy to advance equity, justice, and opportunity for AA and NHPI communities, and happy to share that as a follow-up. But it's going to take all of us to be able to think about how do we do things differently. Right now, we're focused on the implementation of our second executive order on equity to ensure that agencies deliver for the American people, including LEP communities. Agencies, have their next round of equity action plans, commitments that they've made. They'll have, milestones that have been achieved, and ways that they can think about how they can improve those efforts. And I will say that, the agency plans are heavily rooted in being community informed and community driven. So agencies worked with communities to identify those barriers to their programs, to understand what actions they should undertake. And that's why you'll see in more of the plans a greater focus on language access in a lot of areas. As we talked a little bit earlier, we do have the Task Force on New Americans that DPC has regularly convened, interagency, and also engage stakeholders on language access as well. The task force is preparing an action plan that will include a commitment to agency actions that make government work better for LEP individuals. And DPC is working to clear those actions as well. And as we work to implement those actions, I'll say that, we are continuing to convene this task force. Language access continues to be a priority and will remain a priority in terms of implementation.
Great, thanks, Amber. I'm just seeing a lot of folks are writing in with questions. Thanks, everybody who's doing that. And one of them mentioned lep.gov. So, of course, that is another sort of resource that kind of covers, across some of the federal space. So lep.gov, for folks who aren't aware of that, is also a great resource. Melanie, speaking of the questions that are coming in, one of them is about kind of what about the role of federal agencies in making sure that the state and local entities that money flows to from them are actually enforcing federal enforcing federal rules related to language access. And so I think you've already spoken about kind of the responsibilities you have as an agency to look inward at the national level and make sure what you're doing there is accessible for LEP individuals. But this issue of what about the folks who are receiving funds? Could you talk a little bit about what it looks like in such a big agency to be trying to do that?
Sure thing. So we have jurisdiction over any, we call them covered entities. Provider, 1557, I saw a question about health private insurance. We do have jurisdiction with 1557 of the Affordable Care Act. Once that rule gets finalized, we will be able to use that. So insurance companies, states, local governments, grantees, et cetera. And in that work, we oftentimes work, to drive voluntary compliance, because most of the time covered entities don't mean to break the law. But also, as stated before, this is not being prioritized in the right way, or organizations are so small that they're not putting the resources, or they don't have the resources to commit. And I will say that's sort of a broad range. We've had a couple of pretty key examples. So Maricopa County is the largest. So I'm from Phoenix, Arizona. Maricopa County is the largest county in Arizona. It is a very high rate of Spanish-speaking population. It has a very large Latino community. We got a complaint and investigated Maricopa County Superior Courts, who were not translating justice documents, whether it was dependency documents, custody documents, in Spanish. So again, I think I like to point that out, because it is all of it, but also if that is still happening in a place like Arizona, I really think it means we're missing the mark overall, and that we're still seeing covered entities not doing enough. And so we worked with them. We came up with an agreement. They're going to do the training. They're starting to translate the documents. We're monitoring them for a couple of years. The other place we've really seen this in is with states. So we did a compliance review of 19 states during the COVID-19 pandemic, where ourselves with the Department of Homeland Security and FEMA, were made aware that some states weren't providing meaningful access to COVID testing, vaccines, and treatment programs, weren't translating certain things, websites weren't, or were translating and had really bad errors that were limiting access to these programs and services. We worked with these 9 states to train them. We work with these 9 states to come up with resources and plans. And we're continuing that state work, right? We know that the Medicaid unwind is a really important part of this work. For those of you that don't know what that is, right? Medicaid provides critical care to millions of Americans. It remains a top priority of this administration. And we're focused on making sure people have access to healthcare coverage. And during the pandemic, processes that Medicaid enrollees go through to renew their coverage were on pause. And now states are beginning regular Medicaid renewals for the first time in 3 years. And so that means millions of people will need to renew that coverage. And the administration is working with states to make sure they're doing everything they can to keep Medicaid enrollees covered if they're eligible, or reconnecting with them to other coverage options. And we've seen errors happen. We've seen instances where people are losing coverage because of administrative errors. And so it's, that's obviously unacceptable. And we're working with states to do as much as possible. But in that vein, we have at the Office for Civil Rights tried to remind states that in this Medicaid unwind, given the population, it's really important that you're translating things, that you're providing interpreters, that you're making sure your websites are accessible, because again, there is a high rate of limited English proficiency within the Medicaid program itself. I personally have been in states where I have been told by advocates that the call center doesn't do a translation in X language. This call center is not translating in Spanish. This call center is giving misinformation to Spanish-speaking individuals. This is a really big effort across the administration. My office issued a letter to all states reminding them of their obligation under Title VI of the Federal Civil Rights Act, Section 1557 and Section 504, so both in the limited English proficiency and in disability, and identified best practices for states. And so we have active investigations, we have active complaints that have been filed with our office. And so we'd like to remind folks that especially to this group, if you are running into your organization, I think I saw a couple in the chat that I tried to write down, where you think that language access services should be being provided, you're being told they're not available. Those are things my office can be helpful in, and other federal partners are too. And so would encourage you to reach out to us. I can put our complaint page and LEP page in the chat. But it's really an important effort, and one in which we're trying to make sure nobody falls out of the program because, a state forego its obligation. And I saw a couple questions in the chat about Indigenous languages. We have had settlements in HHS OCR with Indigenous languages specifically. There's been some states where in the child welfare space, which is part of HHS's jurisdiction, children were removed or separated from families because there was a lack of translation and accommodations related to Indigenous languages. And so we do have a couple of settlement decrees in that space that we're continuing to monitor with those states. And it continues to be something that we're working on in the Section 1557 proposed rule that we're hoping to finalize.
Excellent, thank you. So Ben, I'm thinking that I might just combine two of the questions that I was planning to ask you. A lot of us over the last few years, MPI, you guys, others have been sending in recommendations to the various task force processes of different things that that we are seeing or hoping to have happen. So I'm just wondering specifically, is there anything more that you'd want to say about the task force activities that you think they can kind of wind up in, and what people should be looking for or hoping for? And I guess I'd put those more, a little bit in a kind of higher level, like a, process level. But then there's also tools or other things that you might think are missing, or that you've been advocating for, just different source of resources that the administration could, or the federal government more broadly, could be devoting to the issue. So that would really make a big difference. So I guess, yeah, so anything you want to say about the particular processes underway, but then also about what do you think could make the most difference, I guess, in terms of advancing language access in federal programs?
Yeah, there's two big opportunities here. One are some really clear practical ways that the federal government can improve its processes, even without additional funding from Congress. And boy, do we need that. I know I'll say it because they can't, but if you look at the budget justification for the HHS OCR for FY24, it makes a very compelling case for how underfunded at least Melanie's office is. And that's true across the board for every agency OCR. In general, though, there's some steps that can be taken, but and more broadly, right? When I've talked to hospitals, when I've talked to local governments, I hear, well, the federal government doesn't do it, so why should we? And I think there's a real opportunity for leadership here by the federal government to set a really strong standard. I'll say, picking up from what was being said around Medicaid unwinding, I've heard all those things and more. We did a little bit of research called every Medicaid agency hotline just to see how you get an interpreter. And there's several that you have to navigate an English language menu, or you do get press 1 for Spanish or press 1 for English, 2 for Spanish, but then nothing, right? For the 20 million plus people who speak other languages, and the 10 million of them that are LEP, right? You can't get to an interpreter, let alone how long the wait time is, or are they a good quality. But the federal government, right, 1-800 Medicare only has press 1 for English, 2 for Spanish. It doesn't have information on other languages. And so there's a real opportunity here for the federal government to do some things like having permanently funded language access coordinators in every agency, actually, which is something that New York State has done. And I hope the federal government moves towards by setting that precedent so that every entity that is federally funded has a clear language access coordinator, or having clear processes and contracting procurement processes for setting expectations for what the standards of a contract should be with a language access provider, so that everyone understands what the expectations are for quality and timing and turnaround, or for having clear responsibilities, right? Having a language access plan is really important. The ground things where we get tripped up, because all you have to do is have that one person, whether they're working for the federal government or they're working for a direct service organization that's funded by federally funded funding, and they're supposed to be asking for a person's preferred language, but either they just like, oh, it sounds like you can get by using English, so I'm not going to ask you if you need an interpreter, or I don't feel comfortable asking you that question, so they don't do it. And then you end up with a problem like in New Mexico, where there's a hospital being sued because a Navajo speaker wasn't provided with an interpreter. And it's just this very exciting opportunity then with the Task Force for New Americans and these other initiatives, where if we can see some really concrete recommendations that get implemented, right? That's the important part, right? We can have as many recommendations as we want, but we need implementation. Then we can see not only really important changes in the federal government, but also a real leadership opportunity for, the millions of localities, millions of federally funded entities that can then follow suit and say, well, this is the best practice that the federal government is doing, so we should probably do it too. And oh, by the way, if we don't do it, the agency for civil rights that's responsible for us is going to crack down and get on our case. So I'm pretty excited about what we're going to see over the next year and a half.
Great. So I'll just say we've got about 15 minutes left, and so we're going to move to Q&A shortly. But my job is so much easier doing this on Zoom, because all of the panelists can see the questions. Well, not all of them, so I think, but it's so I'm just going to say, first of all, folks who are with us, please keep sending in your questions. Super helpful for us to all be able to see them. And I think I'm just going to open it up in a few minutes for each of the panelists to be addressing some of the ones they see that they particularly want to get a whack at. But for now, Amber, I wanted to go back to you, and we talked about the opportunities with the various executive orders and the role of the DPC and sort of getting all of this information from agencies and looking at plans for what they might do. It's all over in the questions about how practical and like tactile it is to try and create these services and really pin them into systems and how they work and sustain them and things like that. So I'm just curious in terms of is there, given sort of that unique role of the Domestic Policy Council, are there particular either kind of resources or structures just kind of concrete steps or tools that you're thinking the administration can take that would support better support all agencies in taking on the issue.
Okay, thank you, Margie. And I also want to just acknowledge some of the recommendations that Ben shared, because I think those are pretty helpful. I will take that back to the team. I too am a former New Yorker, and so we were very fortunate to have systems in place and a very robust language access mechanism, in part by a lot of the work that Margie informed that she was working on previously back in New York. So you take for granted where you have an opportunity where there's a real focus and effort in that space. And so we want to see that for everyone. We want all communities to be able to communicate, to feel seen, to feel heard, and to have the language and services that not only are, provide translation services, but also are culturally competent. I think one of the things that we have focused on as an administration is ensuring that our administration reflects the diversity of America. I think that's very important in terms of ensuring outreach and education for communities. We place a big emphasis on burden reduction and paperwork simplification to ensure that everyone can utilize government forms and services. So I think that's a big area of improvement that we've tried to do in order to make it easier for people across the board to access government services. I think a couple of the things that I'll share in terms of some practical examples in that space, and a couple of examples, just encouraging agencies, to appoint language access coordinators. We know there are several agencies that have those, and making it simpler and easier to procure government services for language access, and also translation services are particularly pressing right now. And then just figuring out, working with communities to figure out where there are gaps. I think that is particularly helpful, and those are some things that we've done through our equity action planning process with agencies. Just really thinking about how we can better serve communities, to hear from them directly about what's not being met, if there's specific barriers, if there are forms that need to be simplified, if there are processes that need those things. So those are the types of things that we will continue to encourage everyone to share. Those that are on this call, I'm sure that others have also shared ideas, but I think those are the things that would be particularly helpful. And then also, as I mentioned previously, ensuring that government agencies also share best practices and learning with one another, so that they're not reinventing the wheel when it comes to securing services, figuring out what languages are needed, and making that information more accessible.
Great, thanks. Melanie, anything else you want to say about sort of like the year ahead that you haven't said in terms of HHS? Feel free. But I just wondered, looking at the questions, could you comment a little bit about just the issue of folks coming up against agencies just saying they don't have the money to do it? And also the particular question that was there about what kind of guidance exists for states that have English-only laws. Like if you're, for a lot of the folks who are trying to advocate for better implementation at the state and local level, I do think that, the first issue, especially about funding, is one that comes up really regularly. But swing at anything else you see in the chat.
Yes. I am not a good multitasker, so I was trying to both read the chat and listen at the same time. So I may need you to repeat the question. So I saw in the chat there was a question about how we investigate and do compliance with states. Typically, we either get a complaint that is filed sometimes by an individual, sometimes by an organization like NILC. For example, the complaint will come to us and then we investigate. We also have the ability to just do a compliance review based off of what we're seeing in the news, or like I was in a state visiting and was told some really pretty egregious things about a state program, and now we're looking into it. So typically we ask for a lot of information to understand what their practices are, what the information is related to the complaint, how the individual or complainant is being treated, to suss out if we think there's a violation. Once we've done that, that can sometimes take, a couple of weeks. It sometimes can take longer than that. Once we do that, we determine if we think the covered entity has actually broken the law, or the covered entity is willing to take corrective steps to correct the conduct. And then if they don't, we can always issue a notice of violation, which then allows us to refer a case to the Department of Justice or go through the defunding process, which is more limitedly used and can be longer. Oftentimes you don't see the work that we do where we drive voluntary compliance because we don't do prep. I mean, we do sometimes when it states because we want to make sure we're propping up that work so that others can see here's what was done wrong and here's how to do this better. But we don't always do the sort of one-off hospital, a one-off provider, one-off dentist, etc. You asked me about funding. So I put a couple of links in the chat. I am not allowed to tell you that there's not enough funding. That I'm just not allowed to. But my office has been flat funded for over 2 decades. So it is what it is. But there are other agencies at the department like HRSA, which works with federally qualified health centers and some of the healthcare training workforce programs, like the Office of Minority Health within the Office of the Assistant Secretary for Health. They have put out funding opportunities in this space. The HRSA one is both in the disability space and limited English proficiency. And the Office of Minority Health is really working with community-based organizations. So we've also tried to work with our grant-making organization within HHS to make sure we're thinking about the size of the organization, who the organization is, so that we're driving equity as we think about these principles and how we're issuing grants and we think about the work that they're doing in this space. And it's also a priority area, right? Like we will have, as Amber said, every single federal agency will have a plan. And that means that the U.S. Department of Health and Human Services, the Centers for Medicaid and Medicaid Services, HRSA, the FDA, the NIH, the CDC, like they will all have updated, very public plans that I fully expect for the public to hold us accountable and to make sure that we're doing as promised. And that if we have a program, a grant, or we have a covered entity that isn't following the plan or isn't following the law and the agency isn't doing so, that they're able to reach out to my office or another office to file a complaint. And so it is very much a very real possibility. And I'll just say, like, my office, we have people who call, I have people who call my regional teams monthly on the regular, because if they don't call the HHS Office for Civil Rights, they are not getting certain documents translated. They're not getting certain translation services. It's not always that way, but I do have folks who very regularly call both for effective communication and limited English proficiency. In an industry that makes up a ton of money, especially the health insurance industry, it is not enough. And everywhere I go, I try to remind folks this is not an afterthought. This is something that should be built into your entire book of business and every single part that you're doing, from the training to the advertising you're doing to how you're actually having your providers connect with their patients and community. And people don't mean to break the law, but like people are breaking the law, and there's more work to do here, and we're working on it. But I also think there's a lot more this industry can do.
Great. And I just feel like I should say too that, there's offices for civil rights and other federal agencies, and that everything that you're saying, folks should be thinking about regional offices and the like in their areas and reporting a lot of the problems with language access that they see to other agencies as well. So I thought Amber and Ben, just looking in the chat, I didn't know if either of you would want to take on the questions that are being asked about language access in the immigration space, just because there's a lot of concerns that, for example, interpreters not being provided in asylum interviews or challenges related to naturalization test redesign. If either of you feel comfortable taking on that, great. And then also, one of the questions has been, if you're looking at this from the state and local perspective, and first of all, if you're in a place with English only laws, are there resources out there that you'd recommend for folks to be thinking of in terms of how to argue the issue in those states? And also, there's funding for these issues within the federal agencies and offices like OCR at HHS, but then also what we hear very often at the local level, that there's just not money in the particular funding stream, for folks to be able to provide the level of any language access or the level that folks are asking for. So if either of you, please just have at it with any of those questions. Amber, why don't you go first?
I will take that question back to the folks on our team regarding some of the immigration questions that have come up. I do know that, for instance, for DHS launched a new online complaint portal that with prompts in about 10 languages to note. So I know that there are a number of things, but let me bring that back to our team, and that way I can hear a little bit more, and we're happy to provide, any written response that we can, or to share back, what's there, and if there are things that we would, you would like us to know as well, please do share that as well.
Great.
I added together a few things. I mean, I think it is, frankly, speaking as an immigration advocate, I can't say anything but beyond it is an injustice that asylum seekers are expected to provide their own interpreters at interviews. And this is what I sort of mean when I say the federal government needs to be a leader. Court spaces are one of the most important places for, this is, if it leads to someone's ability to live in their home or be free or not free, having an interpreter is, speaking English, right? This is racial discrimination. If European speaking immigrants who are more likely to speak English have easier access to asylum processes because they speak English than non-European immigrants, that is, I would say call it out as racist and systemic racism. Yet the federal government is now, didn't during the pandemic, but is now requiring asylum seekers to provide their own interpreters. And this is what I mean when we talk about, putting it a little more broadly around an issue of an attitude of complacency, at every level. This is not the federal government. We need to see private actors really stepping up here. We need to see hospitals, philanthropies, schools, businesses really need a change of attitude. We're going to have growing numbers of people with LEP and growing linguistic diversity, hundreds of languages and greater numbers of speakers of indigenous languages and smaller dialects throughout the US. And we're going to end up in a situation where we just are stuck and cannot serve them because we've been so complacent. And so I'm going to, end on a positive note and go back to what I was saying, where we have a real opportunity. It's going to be hard. These problems are really, really hard, right? We haven't even gotten to interpreter certification and quality. We haven't even gotten to the scary reality of AI. Melanie mentioned it a little bit with machine translation, but the worrying trend, or we may see some real laziness. We haven't really gotten into the issues with reimbursement for doctors and other entities. We need to deal with all of this, but we have an opportunity to start now. There's a much greater awareness of language access these days. There's a much greater interest in addressing racial equity these days. And we need to work together between the federal government, between local and state governments, between private entities and advocates, and come together and start creating this expectation that it is not okay for someone not to be denied access to information or access to a program because they don't speak English as their primary language. And by resetting and setting some real progress and making some incremental wins, we can really start the ball rolling. And I'm pretty excited about the many different pathways and many opportunities that we're looking at.
Sounds great. We're unfortunately at time. I just want to say that I know we didn't get to all of the questions, and I want to I say specifically that Jake Hofstetter, who's been appearing with his picture here, has been monitoring the chat the whole time. He's our lead policy analyst, doing a fantastic job working on language access issues. So we'll make sure to divide up the questions, make sure we get back to everyone, and also maybe lean on our panelists who have already been so generous with their time to get a few more answers. But just many, many thanks to all of you who joined us, and especially to Director Fontes Rayner, to Amber, and to Ben for all the work that you're doing, and also for taking the time here. That you can see on the screen here how you can get in touch with us. and also a few of the resources that we have that might be of interest to all of you. So again, thanks to all the speakers, thanks to all of our participants, and look forward to crossing paths with all of you as some of this work continues to unfold with the administration. Take care.